ඔයගොල්ලෝ මාව තාම subscribe කරලා නැත්නම් මේ රතු පාට බොත්තම ඔබන්න. ඒ වගේ මන් දාන අලුත් වීඩියෝස් පිළිවන් දැන ගැනීමට මේ bell icon එක click කරලා all කියන එක ඔබන්න.
Talk about the perineum. Okay guys, so today let's talk about the perineum. What are the boundaries of the perineum? There are superficial boundaries and deep boundaries. So if we talk about the superficial boundaries, it is anteriorly the scrotum in males and mons pubis in females, and posteriorly it is the buttocks, and on each side medially it is the thigh. Wait, I will show you guys a picture of it. Okay, so here you can see that anteriorly it is the scrotum in male and the mons pubis in females. Posteriorly it is the buttocks, and in the on each side it is the medial sides on the lateral walls of the perineum. The border is the medial side of the thigh. Okay, so if we talk about the deep boundaries are the inferior pubic ligament, here deep boundary is the inferior pubic ligament, and posteriorly it is the coccyx and the sacrotuberous ligaments, tip of the coccyx, and on each side is the conjoint ischiopubic rami, the ischial tuberosity, and the sacrotuberous ligaments. Divisions of the perineum. In the perineum you can see two main regions, and that is the urogenital region and the anal region. So the anal region consists of mainly of the anus and the ischioanal fossa. And the contents of the anal region is the same in both males and females. So in the urogenital region you can see external genital organs, pudendal canal, pudendal nerve. In the pudendal canal you can see pudendal nerve and internal pudendal vessels. So now let's talk about the anal region more. Okay, the cutaneous innervation of the anal region. So this is supplied mostly by the inferior rectal nerve around the anus and over the ischioanal fossa, and perineal branches of the S4 nerve, skin posterior to the anus, and also twigs of coccygeal plexus can also be seen, S5. And also anal-coccygeal ligament is seen in the anal region. This connects the anus and the tip of the coccyx. Okay, it is a fibromuscular structure. The perineal body. So the perineal body is actually the center point of the perineum. So it is also known as the central tendon of the perineum. This is a fibromuscular node. It is in the median plane, and there are like 10 muscles attached to the perineal body, 2 of them unpaired and 3 of them paired. The unpaired muscles are the external anal sphincter and longitudinal muscles of the anal canal, and paired ones are bulbospongiosus, superficial transverse perini, and levatini. The sphincters of the urethra vaginalis is attached here as well, and this can be damaged in childbirth. So the perineal body is in females, it is actually seen between the anus and the vagina, and in males it is seen between the scrotum and the anus. So what is the function of this perineal body? The main function is that it stabilizes the pelvic and the perineal structures, and weakening of this due to childbirth can result in prolapse of the uterus and the vagina. So here I have drawn a diagram of the external anal sphincter. So here you can see this is the rectum, and here and from here to here it is the anal canal. So the internal anal sphincter, it covers the upper 3/4 of the anal canal, and the external anal sphincter covers the entire root of the anal canal. And here you can see the white line of Hilton, also known as the pectineal line. And here it is where the levator ani muscle attach. And so in the rectum, internally you can see the mucosa, and then underneath it you can see the submucosa. The internal anal sphincters and the external anal sphincters are supplied by the inferior rectal nerve and the perineal branch of the fourth sacral nerve. Basically the two nerves in the anal region. So fibers in the anal canal is actually 4 centimeters in length, but in females it is rather shorter. The fibers in the anal canal are circular. And here, here you can see the rectum. I got this diagram from last anatomy actually, so you can see here. And here you can see that the puborectalis muscle actually joins the rectum at the deep part of the external anal sphincter, and then in the middle part of the external anal sphincter you can see the anococcygeal ligament. And here you can see the perineal body. And here where the puborectalis muscle, the levator ani part attached to the rectum, and then the anorectal ring is created. So you can see a ring right here, we call it the anorectal ring. And postnatal plate. The postnatal plate consists of the anococcygeal ligament and the superior fascia of the pelvic diaphragm. So you call that area, you can't see it here, but it's around this area. So that area is known as the postnatal plate. So here is a much more clear diagram of the anal canal. So you can see the outer longitudinal muscle layer, which turns into the conjoint cord, and the internally circular muscle layer. And in this conjoint cord you can see twigs of fibers are like arising from it, and near the middle part of the external anal sphincter you call these the suspensory ligament of Parks. Okay, and here near the pectinate line, also known as the white line of Hilton, you can see anal canal. So essentially the internal anal sphincter and the external anal sphincter, they're kind of joined by valves here, and this forms the columns, anal columns, and also anal columns, and these anal columns, there are anal glands that secretes mucus to them, and levels of the anal valve is the pectinate line, anal cushion. So when these sinuses get inflamed, you can see fibroids and fistula. Anal cushion, fibroelastic, this consists of fibroelastic connective tissue, smooth muscles, dilated venous plexus, arteriovenous anastomosis. So the function of anal cushion is for watertight closure. And here you can see 3 cushions in a human. So in the right it is in the right lateral part, the right posterior part, and the left lateral part. So the blood supply of the rectum is superior rectal artery, the medial sacral artery, they supply the upper part, and the inferior rectal artery supplies the bottom part. The rectal venous plexus. In the upper part, you can see the superior rectal vein and the inferior mesenteric artery. Actually, the superior rectal vein drains into the inferior mesenteric artery. And the lower part, you can see the inferior rectal vein and the middle rectal vein. And if you talk about lymphatics, the upper part, you can see lymphatics of the rectum. And in the lower part of the canal, they drain into the superficial inguinal groove. So now let's talk about we talked about the anus, right, which is in the anal region, and now we'll talk about the ischioanal fossa, which is also known as the ischiorectal fossa. So here I have drawn a diagram. This part here is the ischioanal fossa. So the base of this is the skin of the perineum. The apex of this is where the obturator fascia meet the anal fascia. Anteriorly, you can see the base of the perineal membrane, and posteriorly, you can see the sacrotuberous ligaments and the glutes. And also, you can see in the anal region there are actually 3 recesses. So the anterior recess, it can actually extend up to the pubic symphysis. And also the posterior recess, it extends posteriorly, and the horseshoe recess, this actually connects the left and the right ischioanal regions, and it conjoins behind the retrosphincter area. So if one part of the ischioanal fossa gets infected, the infection can travel along the horseshoe recess and can infect this part as well. And there are 3 spaces: the perianal space, ischioanal space, and the pudendal canal. So in the pudendal canal, I mentioned earlier, pudendal nerve and internal pudendal vessels can be seen. And here, what are the contents of the ischioanal fossa? You can see fat, the pudendal canal, inferior rectal nerve, perineal branch of the 4th sacral nerve, posterior scrotal, posterior labial nerves, and perforating cutaneous nerves of S2 and S3. Okay guys, so that is all for the perineum. I hope you guys understood.